Namaste, all the viewers and friends. It's been quite some time that we had come up with our video sessions for you. Today, we are very excited to come back with our video discussions, and the topic for today is vertigo. Before I start, I would like to thank all the subscribers and our viewers who are viewing our videos and are encouraging us to make these videos. And I think that is the excitement that we have after a long back that we have come up with our topic again. So like I said, the topic for today is vertigo, which is it is a symptom mainly than a condition itself, because a lot of conditions can cause vertigo. So let's understand what are the causative factors for vertigo, what basically contributes to the symptom of spinning. So vertigo is basically when somebody feels that they're spinning, or the environment around them or objects around them is revolving or spinning, right? So the causes for vertigo are if there is a sudden movement of the head, rapid sudden movement of the head, that can trigger dizziness. It can also be caused by migraine headaches. It can be caused by inner ear infection, which is called the labyrinthitis. It can also be caused by inflammation of a vestibular nerve, which goes through the inner ear again, and if there is any inflammation of that nerve, that can also trigger vertigo. Basically what happens with these causes is that there is a sense of imbalance. So it affects the balance system of the body. So there is that sense of imbalance and dizziness. For some people there is also heaviness in the head, kind of muzziness in the head, where they do not have clarity of thoughts and they are not able to, that kind of blocked feeling is there for some people. Some people also have headache. Some people also go through tinnitus, or the sound that is constantly heard in the ear. So there are different presentations of tinnitus and of vertigo, I'm sorry. But many a times vertigo is a self-limiting condition as long as the causative factor is taken care of. For example, if there is an inner ear infection, and if that infection is taken care of, the symptoms of vertigo will also resolve. But traditional medical systems give a different view or perspective of vertigo, and once we understand this, it will help us manage the symptoms of vertigo, the condition in itself, in a better way. So according to traditional systems of medicine, vertigo can be a presentation of two different things that happen in the body. First thing is energy deficiency. For example, if we have energy circulating throughout the body, we have understood that balanced energy flow is health. And if there is any imbalance, be it deficiency or stagnation or excess, it causes some sort of a disease or a disorder. So vertigo can happen if there is deficiency of energy, because of which energy will not reach the brain or the head region properly. So that is one of the reasons for vertigo. The other is excess. If there is sudden peak of energy flow that happens and there is sudden rush of energy to the brain, that can also trigger symptoms of vertigo. It's like if there is low voltage, also there is issue. If there is high voltage, sudden voltage, also there is an issue. So this is also something very similar in presentation. But we have seen in clinical practice that even for people who have excess causes or excess symptoms of vertigo, that sudden rush of energy can lead to long-term deficiency. So it doesn't mean that if I have excess energy, I am like, oh, I have a lot of energy, I have to just balance it. No. If I am using, or if my energy levels are not balanced so well and there's sudden rush and peak of energy flow, it can eventually lead to a deficiency of energy, which requires lot of nourishment. So from the traditional perspective, the main principle of management is nourishment. If it is deficiency or excess, nourishment is mandatory. And based on whether it is deficiency or excess of energy, the other principles of management will change. For example, if it is because of excess flow of energy, we will have to balance it. We will have to bring down that peak of energy flow by using acupuncture points accordingly. So we were coming to that part where understanding the traditional perspective, shifting to the management part now is mainly with acupuncture therapy. So when we do acupuncture therapy in vertigo, our point selection or acupuncture points that we do on you will depend on whether you're coming with deficiency or excess or combination. So if it is deficiency, we will focus a lot on boosting your energy up, nourishing your energy, along with, of course, lifestyle modification. Food is a major factor that nourishes you. So balanced and healthy food intake is also very important. Sleep is also very important. Your mind, psychological management is also important. For example, if I am angry and sudden anger outburst can lead to a peak of that energy flow to the brain and can lead to vertigo. If I am traveling and there's sudden movement of my head, or the vehicle kind of because of a road curve, there's a sudden movement, that can also trigger. So based on these triggers, we will see whether we'll have to focus more on nourishment or bringing down your excess is a priority. So acupuncture is very, very helpful in supporting the symptoms or management of vertigo. And if it is caused because of, like I said, infections and inflammation, acupuncture again helps in bringing down the inflammation and also help improve the immunity so that the infection can also be taken care of. So local symptoms of dizziness, pain, headache and tinnitus can be managed, and if it is systemic cause of energy imbalance, that can also be very well managed with acupuncture therapy. Along with acupuncture, once your symptoms are reduced by 50-60%, if we start yoga practices, mainly breathing exercises, Brahmari pranayama is proven to be very, very helpful in managing vertigo. So Brahmari, Omkara chanting, listening to the chantings, proper practice of relaxation techniques, and gradually starting the practice of even asanas or postures will give us a holistic management of vertigo. So to sum up, based on the causative factor, we will plan the treatment modalities and treatment principles. It will start with acupuncture therapy, followed by yoga therapy, and when both these are happening, acupuncture and yoga is happening parallelly, we will take care of how and what you should eat, how much you should eat, when you should eat and all that, and also if it is a psychological contribution issue that is contributing, that will also be taken care of. So this is going to be the summing up of management protocol that we have for vertigo. So if any of you have are going through vertigo, please visit our clinic and we'll be glad to help you manage your symptoms and condition. With that, I end today's discussion. I'm sure I've given you enough points for understanding the vertigo as a condition and a symptom in itself. Thank you.